Okay, good afternoon, everyone, and thank you for joining us on this webinar hosted by Primary Care Development Corporation. My name is Joel Nepomuceno, and I am the membership manager here with the National Council based out of Washington, D.C. If you have any questions at all regarding your affiliation with the National Council or would like to have a discussion on how we can help you make the most out of your National Council membership, please do not hesitate to contact me or my colleague, Neil Comstock. We are here to help. With that said, a lot of the feedback that we got from our members is that one of the biggest barriers that they have to offering optimal service and staffing to their community is financing. So we invited Primary Care Development Corporation to present this webinar on Capital Financing 101. But before we get started, here's Neil Comstock, our Director of Membership, to give a quick reminder about a meeting that we have coming up in April with 6,000 of your closest friends and colleagues in just a couple months.
All right, thank you, Joel. Neil here, if you guys could advance the slide, that'd be great. So we very much hope that you can join us in Austin, April 5th through 7th for our NatCon 20, our big annual conference. It's the biggest behavioral health conference in the country, and 6,200 people, the convention center, 12 hotels. It's going to be a terrific experience full of content as well as opportunities to get to know and meet with people who are probably facing some of the same challenges that you are. So please plan on joining us, again, April 5th through 7th in Austin for our NatCon 20. We could go to the next slide. Some of our key speakers will be Brene Brown, the renowned author who is impressive and engaging. We'll have this year for the first time ever, Johnny Taylor, the President and CEO of SHRM, the Society for Human Resource Management, which I know, HR issues are a recurring theme and challenge for some of our members. We'll again have the inspirational Johan Hari. And also again, for the first time rather this year, we'll have a very inspiring speaker named Carla Harris. She's the Vice Chairman of Morgan Stanley and talks about, a topic not unrelated to what we're going to talk about here today, financing for behavioral health. So please, again, plan to join us in Austin, April 5th through 7th for NatCon. And you can also see our friends from PCDC there. And with that, let me turn it back to you, Andrew.
All right, great. Thanks, Neil, and thanks, Joel, and thank you, National Council, our partners in this endeavor, and of course, to the National Council members and everyone who's on today's webinar. We're really honored to be here. We're excited to be talking with folks, and this is a conversation that's really been going on for a few years now with National Council, and really was inspired by you, the members, as we communicated with you at NatCon just last year. So my name is Andrew Phillip. I'm the clinical director the director of clinical and population health here at the Primary Care Development Corporation. I'm a psychologist by training, so this is a topic that's near and dear to mine and our hearts. A little bit about Primary Care Development Corporation, or PCDC. So we're a national nonprofit. We were founded here in New York City in 1993, and it really grown and expanded over time. But throughout this journey, our focus has always been on really increasing health equity, starting with primary care, but of course now increasing into behavioral health and even other areas. So we do this work through and which my colleague will talk about today, is investment. So investing capital into building out infrastructure and just the capacity to meet the healthcare needs, particularly in low and underserved communities, as well as transforming care through our training and coaching efforts around things like incorporating HIV into healthcare, combining primary care and behavioral health services together, increasing cultural competency in other areas. And of course, we also advocate with the state and federal and other municipalities to advance the capacity of healthcare as a whole to really deliver care where it's needed most, and with the funding, frankly, that's needed to do it. So I'm particularly proud of our impact at PCDC. You can see some of our numbers here. I think of particular interest today is that we've leveraged over $1.1 billion, particularly into low-income communities, again, to build the capacity and infrastructure to provide necessary services. We've also trained over 9,500 folks across the country to improve healthcare service delivery. But again, we're here to talk about particularly behavioral health and the needs around this. And this is an area that we really view as fundamental. So again, we started with a focus on primary care because we know that primary care is where it's a fundamental and critical access point where many people can really enter into healthcare for preventative and primary care services. But we also view behavioral health in very much the same way as that kind of critical initial access point for services for people with predominantly behavioral health needs. And the interesting thing that folks on this webinar and we've certainly observed is that whether your entry point is primary care or behavioral health, if you can't adequately access those services, your lifespan is lower, your quality of life is lower, and those complementary services can't quite be offered enough. We know that people in behavioral health have a greater need for accessing primary medical services, and people who are seen in primary care often need to get their behavioral health needs met in an even more significant way in primary care. And yet we've known, and our partners at National Council for Behavioral Health has really advocated for this, there's been a struggle for parity, for getting essentially equal pay and reimbursement that's commensurate with the level of services provided, and also sustainability. Behavioral health clinics in particular have unfortunately really been subject to kind of very meager funding streams, frankly, in the past, being expected to sustain through very restrictive billing codes, but also even well-intentioned grants. These are short-term funding sources that can be difficult to sustain. I think this is something that almost everyone is keenly aware of. And so we've been looking into how can we help build up infrastructure in addition to some of these methods that are already out there. And so I'll turn over in just a moment to my colleague Bill to talk about this, but I did just want to make note that we have a lot of resources available through PCDC in addition to our capital investment that we'll discuss. We've just issued a new report on the integration of primary and behavioral healthcare that you can download at pcdc.org. We publish around the integration of primary care and behavioral health. We host convenings, and we also offer free training on topics like how behavioral health providers can help address diabetes or how they can incorporate things like addressing chronic pain. So you'll hear more from us as well as National Council on these topics. But with that, I'll turn it over to Bill O'Brien, our Chief Lending Officer here at PCDC, to talk about what the heck is a CDFI and what are we doing here? And then also, how can folks on the line really learn more about investment and getting the finances that you need?
Thanks, Andrew. We have a lot to cover today, and we want to make sure we leave about 10 or 15 minutes at the end for questions. So I'm going to go through things pretty quickly, but rest assured you will have our contact information at the end, so anyone who wants to reach out to us can with any questions we don't get to your specific question. Very quickly, and I want to get through PCDC quickly because I want to get to the heart of what we're talking about. But there is a question as to why are we speaking about behavioral health and how to finance the expansion of a center. And PCDC is in a unique position to address that topic. We are classified as a Community Development Financial Institution, or a CDFI. That may be a term that is new to some folks. It is simply the designation by the U.S. Treasury through its CDFI fund to organizations, to financial institutions that take a market-based approach to supporting organizations operating in economically disadvantaged communities. We provide capital and technical assistance to those organizations that operate in those communities. Most CDF, today there are about 1,000 to 1,300 CDFIs working nationally, and we invest about $4 billion more or less in organizations that help to advance their communities. Most CDFIs invest in a broad spectrum of types of sectors. The most prominent is low-income housing. There are others like education, the arts, small and women minority-owned businesses, etc. What makes PCDC unique is that we are focused exclusively on healthcare. So while our peers invest in those very worthy projects, our mission is very narrowly defined. Having said that, we go deep into healthcare, And so to echo Andrew's points, we focus today on behavioral health and community health centers to provide a holistic approach to their patients' needs. What are PCDCs products? So they can basically be boiled down to 4 general categories. One is traditional financing, and that has to do with what you would expect a financial institution to lend into. Basically the expansion, the physical expansion of an organization's footprint. So that would involve long-term capital to support projects such as property acquisition, construction, long-term financing, et cetera. Access to healthcare and behavioral health services also means staffing. So PCDC launched a provider recruitment and retention program that has dedicated capital aimed at helping organizations recruit and retain providers. And that dedicated pool of capital is offered at very, very low interest rates. Similar to that is our Transformation Loan Fund, which is really, it's entitled deliberately broadly because it's aimed at helping organizations integrate services such as medical into a behavioral health platform, but also to help organizations as they move towards a value-based payment and try to address the costs that may be explicitly or implicitly encountered as part of that. What might that be? An EHR platform may be financed by the vendor, but what is not financed is the decrease in productivity. And so while you may find your revenues declining, your expenses will stay the same, and so that creates a net earnings gap. This fund could help plug that gap temporarily. Similarly, you may need to hire care coordinators or even analysts to help quantify the outcomes as you move towards a value-based payment model. This fund could help finance those positions. Lastly, and I'm going to touch on this very briefly, we offer a very robust New Markets tax credit program. And that is it's a federal program. Essentially, organizations like PCDC receive tax credits and exchange those credits with third parties for investments into projects. And it's extremely beneficial to sponsors of the projects, like a behavioral health center, because it can offset about 20 to 25% of the eligible costs of those projects. I won't, now that may sound like something we want to talk quite a bit about, and we can at another time. It's a very complicated program with many restrictions associated with it. So I'm happy to discuss that on its own at another time. Lastly, just to give a sense of what we've done, we currently have just shy of $270 million of assets under management. Regarding those New Markets tax credits, we've been awarded almost $250 million over 5 rounds. We finance projects across 13 states, and their typical financings are for facility related, as I mentioned before, permanent financing, which typically refinances construction to help the organizations pay off their debts, business acquisition, technology, staff investment, as I mentioned before, and restructuring. So, to get to the heart of the issue, if an organization is looking to commence a project, one of the fundamental questions they have is how are they going to pay for it? And no matter what choice you go to, there are going to be pros and cons, and that includes grant financing. Now, grants have the obvious benefit that they don't need to be repaid. There is no interest expense associated with grants. So that's by far the predominant benefit. And we encourage all of our clients to pursue those types of funding streams. The considerations with that, though, are significant. They typically are hard to get. It is time consuming to get them. They are frequently insufficient to cover all the costs, and they are often structured as reimbursement grants. So even if one is fortunate enough to get the grant, it presumes that the organization has capital to invest in the project in the first place. A secondary source of financing might be government programs. And by that I mean that it could be federal programs such as USDA, and municipal bond or loan programs such as an environmental development corporation. There your benefits are, they're typically low cost. They are long dated, so they will mature over several decades. And as a result, the monthly payments can be very low. But that in and of itself could create some problems. First, they are difficult to get. I have accompanied clients to EDC, county EDC offices, where the EDCs have been more focused on commercial ventures rather than social services. Those long maturities are very attractive unless you want to repay them earlier. And if there are prepayment restrictions, you may be prevented from doing that. Commercial financing is another viable alternative, and that's typically bank financing. There, the answers come back relatively quickly. The process is usually 3 to 6 months, and except for the equity investment of the organization, it may cover all the costs that are associated with the project. Conversely, there is the problem of lender appetite. Banks are typically reticent to lend towards smaller nonprofit health centers, and that includes behavioral health centers. There may be an education associated with this, where the loan officer or the credit committee at that bank doesn't understand the business that you're involved with. There may be pre-penalties associated with the loan, and there might be hidden pitfalls. We have had clients who have explored something like a no interest loan. And generally speaking, that falls under the heading of if it's too good to be true, it may be. We've seen cases where clients have been approved for these no interest loans, but what's going on behind the scenes is that the loan amount is actually increasing as the lender pays itself the interest. And at maturity, that borrower would have to pay back a significantly higher loan than they originally borrowed. CDFI financing is something I would encourage folks to consider because it has many of the same benefits as a commercial lender, but you potentially avoid some of the pitfalls. So the response time is similar. It's usually 3 to 6 months. The terms are very flexible. CDFIs tend to pride themselves at trying to meet their borrowers' needs where they are. There is a mission alignment. That's critically important because the CDFIs will take the time to understand your business model. And depending upon the source of capital that's being used, your interest rates might be low. CDFIs typically, not always, but they frequently charge an interest rate that is in line with the capital source that they are using. So if it's a geographic or a business sector loan program, you may benefit from a very low interest rate. The flip side to that is if it's not a dedicated loan program, that interest rate might be higher. There's frequently limited availability. By that I mean if the loan amount is too big, a CDFI might need to bring in other peer organizations, another CDFI. We frequently do that with our peers. And there may be a limitation on the CDFIs itself. You may be in a location where there aren't CDFIs locally. In that case, you would turn to a national CDFI. And then finally, tax credit financing, which I just alluded to. New markets tax credits bring with them significant subsidies. They are typically, you would find 20 to 25% of the project costs could be financed through new markets. The benefit there is you may not need to pay that portion back. So just to make up an easy number, if it was a $10 million project, say $2 to $2.5 million could be sourced through new markets tax credits. That's a very, very attractive feature with that program. The considerations is that the program is very complex. It is very competitive. Institutions like PCDC compete with each other for those credits. And then we have to then look at what are all the projects out there that are asking for this kind of financing. So it is competitive at our level and then competitive at the client level. It brings significant restrictions. It is, at the very least, it is an address-driven program. So the project location has to qualify, and that's per federal terms. That's not up to the CDFI. It's the guidelines set out by the federal government. And due to the nature of the program, it works best with larger organizations, larger projects. So projects of $5 million and up. So if somebody was interested in using debt to move their project forward, what should they be thinking about? Well, commercial debt, loans in general, is a very common tool used by for-profit companies. They frequently use debt for working capital, for their construction purposes, for mortgages, for long-term capital, mainly because they have very limited options otherwise. It is less common, though, for nonprofit companies, particularly for behavioral health providers. And I would encourage organizations to think about debt as a useful tool, even when it comes to looking for grants or from the government or from foundations or even companies. And that's because debt is a practical partner when it comes to donors. It can provide a jump start to a project where donors will look and see that there is already financing in place, that the project has already been vetted, if you would, by a third party, and it may incentivize them to structure some kind of a donor program. It also, as we mentioned before, it could be a bridge financing to those reimbursement grants. And we're looking at a client right now who was awarded a $12 million project, but is really looking at a $2 million loan. They don't need a full 12 million. All they really need is something to get the project going. And then they would be continuously reimbursed by their funder. Lastly, it implicitly creates a disciplined performance monitoring. But not to say that organizations aren't already disciplined, but it's a different type of discipline. Lenders will expect there to be some financial controls at the organization. And this is an excellent opportunity to set up those controls and monitor debt service coverage ratios, et cetera, that we'll talk about in a minute. So quickly, if someone were going to be preparing for a loan, what would they need to do? What would they need to prepare? Well, that generally falls into two very broad categories. One are qualitative requirements. First and foremost, you need to explain to your lender, your prospective lender, who are you? What do you do? And why is this project important to the community? What experience do you have with projects? Who on the team, the management team, will manage this project? Now, it is very common for organizations that are only a few years old to have never done another project beyond the actual foundation and startup. Everyone faces that at some point. In those cases, that need not be an obstacle, a permanent impediment. In those cases, you would want to hire external consultants that do have that depth of experience. But still, someone on the management team does need to oversee that entire process. Finally, and this is critically important and frequently gets overlooked, there needs to be community support for the project. And that is different than community need. We would want to see there being community need, and that gets back to that first point. But just because there is need in the community, as many of you know, that doesn't mean the community supports the actual project itself. So we would want to see that. And any lender would really want to see that. What would that look like? Well, at the very least, the board needs to be supportive of the project. The board itself should be made up of representatives of the community, and that will give any lender insight as to how, the minutes of the board meetings will give insight into how the community should be looking at the project. Beyond that, we would be looking at government leaders, so a county supervisor, civic leaders, mayor's office, a city council, church leaders, what have you. You know your communities best, but the leadership in that community ought to be demonstrable in their support of the project. What would quantitative requirements look like? Certainly, at the very outset, the organization should have a strategic plan. So you should put together a budget for what the project is going to entail. Think about a marketing plan. We can tell you we've done hundreds of projects. Do not believe if you build it, they will come. That they may be interested, but they may not actually show up. So what you definitely want to do is think about how will you be going about raising community interest in the project that you're about to launch. How will this new site or this new service that you're putting into a new location, how will this fit into the organization as a whole? How will it be managed? And how will that new operation fit into the existing one? You definitely want equity in the project. Depending upon the lender, you would expect to see somewhere in the neighborhood of 10 to even 35% equity. Commercial banks tend to want more equity. They typically, their limits are about a 75% loan to value, which means they would lend up to 75% of the value of the project. That value can be defined as either the appraised value, which should incorporate the costs of the project, or the costs themselves. But either way, commercial lenders typically will invest 65 to 75%. CDFIs will go higher. They'll typically go to 85, maybe even 90%. But that still presumes the organization needs to inject, say, 10 to 15% of the cost of the project. You need to demonstrate what your cash flow is. There is an old expression in the accounting world that cash is king. And the reason why that still holds true is because it's cash that pays the bills. Net income does not equal cash. And certainly, we all want to see the organizations generate positive results. But at the end of the day, we need to see that there's positive cash flow sufficient to pay debt service. And we'll touch on that in a moment. We would want to see, and again, I say we, any lender would want to see historical performance and positive performance, usually 3 to 5 years history. Now, most organizations, particularly organizations with more narrow operating margins, may not have 3 to 5 years of uninterrupted positive performance. Most will have some levels of hiccups during that period of time. That's okay, but you need to be able to explain why there was a downturn in a particular year. Was there a change in EHR? Were there a significant amount of provider shortages or providers leave, bad weather shut down, or a disaster shut down the operation for a few days or weeks. Those kinds of things are reasonable, and they happen, and we've seen it. But just be prepared to explain that. And then finally, explain what this project will do to the organization, and be able to project in terms of results, financial results, out, say, 5 to 7 years, what this is going to look like. We tend to look at things pragmatically. I've yet to find an organization that projects negative performance over the next 5 to 7 years. But what we are looking for is realistic performance. If your organization has historically generated, say, a 2% operating margin or net margin over the past 5 to 7 years, it would be surprising to see them going ahead generating 10% operating margins over the next 5 to 7 years. In fact, that first year may actually be poor. It may be, 1 or break even. But certainly going out, it should be in line, more or less, with what you've done in the past. If it isn't, and it's legitimately different, be prepared to explain why. So one of the most common questions, and here we'll get to something most people are very curious about. A common question that is posed to PCDC is, how much could I borrow? If we want to do this project and we need to borrow money, how much can I expect to get? And what can I do to meet the shortfall? A term that almost every lender uses when it comes to measuring debt capacity is an acronym called EBITDA. And what that effectively is, it stands for earnings before interest, depreciation, and amortization. And it functions as a proxy for cash flow in your income statement. Now, why do we do that? It's because cash flow statements are typically a little bit tricky to compile for the finance department. Your revenue statement can be built off the GL, and it can be produced on a monthly or a quarterly basis. And for any lender, it's a very easy way of looking at what is essentially your operating income, and then adding back depreciation and interest expense. Now, why would we do that? It's to try to estimate what your net cash results are. And we are assuming that your accounts receivable turn pretty quickly, that you receive cash, and that should be a relatively common thing for behavioral health organizations that operate under contracts that should be paying regularly. I know we say should, hopefully they do. And that manage, and generally speaking, it's our experience that vendors are paid very quickly. So the accounts payable tend to turn very quickly as well. If we add back depreciation, which is a non-cash expense, then we're getting close to what is the approximate cash position of the organization in terms of for the period. We also add back interest because we're going to be measuring how much interest can you afford. So we don't want to count it twice. So once you've identified what the loan would be, and we've assigned an interest rate and a maturity date, we can now very easily quantify what's the periodic debt service payment. I say periodic, I mean monthly or quarterly or annually. So if we say annually, then we're going to look at, well, what's their approximate cash position, EBITDA, for the year. And lenders want to see some cushion, some amount more than the debt service that will be paid in that year. So just to pick a number, if the debt service was going to be $100,000 for that year, most lenders would want to see at least $125,000 in EBITDA, and that's 1.25 debt service coverage. that 1.25 debt service coverage is one of the most important covenants you would expect to see in your loan agreement. Generally speaking, lenders want to see more than that. They may not require you to keep 1.25 times debt service coverage. But they would expect to see at the outside more than that, say 2 times, et cetera. That's not overly difficult to do. And one of the things you can do there is manage how that loan is structured. So, depending upon maturity dates and interest rates, you can achieve a positive result. So I'm not going to go into this, and I have a feeling there is a general sigh of relief. I'm not going to go through all these terms, but I put them up simply. This will be available from our website, I believe, NatCon's website. But these are important terms that your finance department should be aware of if they are going to be considering a loan. Certainly, days cash on hand and days receivables are something you probably are used to looking at. We've just covered EBITDA. Leverage is the amount of debt that the organization can maintain. The debt service coverage ratio is what we've just covered, and that is a critically important covenant that you would want to discuss with your lender. Covenants are essentially promises, agreements that you make with your lender, and they can be in terms of reporting as well as financial covenants, and then your leverage ratio, which is typically measured as debt to net assets, and that lenders are interested in just to see how much debt you're taking on, and the lower the number, the better. So, one thing that I think what could be useful is to see an actual case study. And we are not going to go through every single one of these line items for sure, but what I wanted to illustrate was what is the process by which an organization that approaches a lender, what does that process go, what's it like? And it's a bit of an iterative process between the lender and the client. A while ago, a behavioral health organization approached PCDC with a request to borrow $500,000 that they were going to use to acquire property, and then at a later date, in the not distant future, they were going to develop that property into a standalone behavioral health center. And as we got to know them, and they approached us, and we got to know them, we were very impressed. They had a long-standing position in their community. The project itself was going to provide services that did not exist yet in the community. They were interested in doing this in a very disciplined manner. This was the latest in several different projects that they had done over the prior 10 years. So everything looked very, very good in terms of qualitative information. And so we asked them to complete an application, which is the beginning of a formal process, and send us their financials. And when they sent the financials, we were both surprised and quite candidly disappointed to see that their current financials were actually very poor. They had a large revenue position, but their expenses were exceeding their revenues, such that not only did they have a net loss for the year, but even their EBITDA, their cash flow, was negative. So obviously, if they can't meet their obligations now, it would normally, just looking at this, it would preclude them from taking on any debt at all. That would only worsen the situation. So that was surprising to us. And so we said to them, and they came back saying, well, this is atypical for us. We usually are doing pretty well. So we said, well, please send us your historical results. So they sent the prior 3 years, and we saw immediately and by the way, what you're looking at are is our own spreadsheet that we take the client's financials and we incorporate them into our own models. And when we did that, we saw right away that that they were correct, that they were accurate in their description, that historically they were actually doing very well. They had generally positive net earnings, and their debt service was actually very good. You know, as you can see there, it was between 3 and 5 times what their actual debt obligations were. So their EBITDA was positive every year. So that gave us some real comfort. So we had more conversations about what was going on this year that resulted in their atypical performance. And it was because they had changed over the EHR platform, so revenues declined. Their costs, associated costs, were going up because they had to implement some new systems. And then they were also hit with the departure of some providers. And so as a result, that was what was creating the problem. The EHR system was now up and running. Productivity was back. They had hired new providers and they seemed happy. So those problems that were creating the negative performance were essentially cured. And they sent us their projections over the next 5 years. And we expected to see a positive performance, but we were very happy to see that management's projections were very much in line with, in terms of margins and performance ratios, very much in line with what they had been in the past. So they dipped in the beginning, which we were actually happy to see. That's a very practical approach. And then they began to grow. On the outlying years, that's typically very formulaic, which means, you know, it gets harder and harder as time goes on to be specific in what's going to happen. None of us know what's going to happen 5 years down the road. But certainly within the next, say, certainly 1 year and 2, maybe even 3 years, you can project what we expect to happen. You know, this service will wind down while this service will increase. And they were very much in line with what they had done in the past and showed positive performance. As a result, we approved this loan, and we were very happy to make it. We were very excited to be part of this organization's service to their community, and it gave us a chance to be in that community. So my last slide is just, so what happens when, you know, what now? If somebody is going to look for financing, what would they need to do? Well, at the very outset, we always suggest some type of a needs assessment. That is typically triggered by a sense that management has that something is missing or something's needed in the community you're serving, or a community that doesn't have services. We encourage folks always to have needs assessments, preferably conducted by a third party. Consult with the community. Once you get the needs identified, speak with the community and see what the receptivity is for your services. And then think about what are your options for delivery. You know, is bricks and mortar the best idea? Is a relocation to a new site beneficial? Is it beneficial to simply acquire a similar kind of an organization, either for-profit or perhaps a peer that might be in some distress? Is an alternative delivery preferable, meaning a mobile service or a telehealth kind of a program? Begin planning the project, come up with a working timetable, identify who the team is going to be, both internally and externally. We talked about the board. Identify who the project management team will be. That should include a project manager, which typically is external, but could be internal. Eventually, you'll be sending out bids for contractors. And we always encourage folks, if they use new markets tax credits, to use a financing consultant. That's universally our advice when it comes to new markets tax credits. Work up a budget, and then discuss what I mean by corporate expectations. Discuss what the project and its outcomes will be with department heads. This will both alleviate any fears they have and concerns they've got with what the project will do to their jobs and to the organization. But it will also serve to manage expectations, and so people don't have overly optimistic expectations. And then finally, explore financing. Prepare your narrative. I kind of lump it into the 5 W's plus 1. Who are you? What is the project? Where will it be? What's your timetable? And why are you doing it? And then finally, how much do you think it will cost? Put together your corporate narrative. Who's the management team? What's the history of the organization? And what are your historical and projected performance results? And then begin to reach out to your own reference sources for partners. Certainly NatCon has advice as to who is active in this field to provide these services, your state associations, and then I highly encourage you to speak to CDFIs. There is no obligation for their advice. Certainly people contact us all the time. We welcome the opportunity to discuss your projects. They will help you estimate your debt capacity, begin fundraising. It's never too late or too early to start fundraising, and then look to the different sources of financing that we've touched on: government, banks, CDFIs, and then tax credit financing if your project fits the criteria. And that's it. That's our presentation. I think we've managed to leave some time, and thank you.
So we've got a couple of questions. This is Andrew Phillip that have come in here, and so one of the first questions, and Bill, curious your thoughts on this. We have someone who's asking, and you got into this a little bit towards the end about assessing an organization's credit risk, but I think this is an interesting question specifically around their funding stream, but also whether or not their internal systems like billing and staffing are really sufficient to take on debt or credit.
Yeah, that's a great question. It's somewhat subjective. And not to be quiet about it, it becomes more subjective as it becomes less objective. What I mean by that is, if an auditor, so we always look for audited financials, and if the audits come back clean, then that's kind of a baseline that says there are sufficient financial controls, there's sufficient staffing, etc. So in that sense, that's what I mean by objectively, this seems fine. What we would then do, and what most lenders would want to do, is take a look at how a lot of problems often come up with receivables. And lenders cue into how old are your receivables. Meaning, if you provided services and you billed for those services and they're 30 days outstanding, that's normal. 60 days, that's worth a conversation. 90 days, we're beginning to get questioning whether they will ever be paid. We've seen organizations hold receivables out for months and months. And what they're really doing is trying to avoid a problem. And that's where things begin to get subjective. And that's where we would have conversations with the finance department. We would normally we always meet with the CFOs anyway. And even if that was fine, Andrew, to your point about, is it sufficient? We always have questions and conversations with CFOs and finance directors just to hear how they view the organization. How involved are they? how familiar are they with the I don't want to say profitability, but certainly the operations of the various services and locations. And the less, the less familiar they are, or the more they aren't sure, the more we would think, this organization needs to get a closer rein on it. That doesn't necessarily mean we wouldn't make the loan, but it would mean we would want to see perhaps tighter controls, and we may put into our, our loan agreement, we would expect to see, reports coming out more frequently. We might want to see certain impact numbers, what are you doing to your, within the community? And while that tells us what we are looking for, it kind of nudges the organization to set up the controls they need to put in place. Ultimately, it benefits the organization, not just us.
Great. So again, we have a couple of minutes left. We're going to turn it back over to the National Council in just a moment here. You have both Bill and my contact information on your screen here, and so we're certainly open to continuing the conversation. As we mentioned, we will be at NatCon 2020 this spring with many of you. We'll have a session on related to diabetes. Just type my name and you'll find it. But also we'll have our booth there, and so Bill will be there along with others from our team to kind of continue this conversation. And I'd also like to take this opportunity to point out that we have an upcoming 7-part series with the SAMHSA Center of Excellence for Integrated Health Solutions, which is housed at the National Council for Behavioral Health, on helping behavioral health providers address diabetes within their setting and within integrated care teams. And so you're about to get the link for that in your chat. And so if you have any other questions, again, please continue to insert them in there. Yes, the PowerPoint will be, we're actually going to email out everyone the link to the recording and to the slides tomorrow, so you'll be able to access both of those things. But I know National Council folks have a couple more things to say, so I'll turn it back over to you guys.
Well, we just wanted to thank everybody for attending the webinar. Thank you, Primary Care Development Corporation, on hosting the webinar. We look forward to seeing everybody at NatCon 20 in just over 2 months. And if you all need anything else from us, if there's anything we can do, if you have any questions regarding your membership, please feel free to contact either Neil or myself. And that is it.
And we also have 5 more minutes left on today's webinar. So if you have any questions, please feel free to go ahead and submit those right now, and we'll try to get them answered.
Actually, so this is Andrew. While we have a couple minutes, there was something that there is something that I as a my background is in behavioral health and as a psychologist in primary care, and so kind of when I learned about PCDC and kind of getting into the world of financing, it's a little intimidating. It was something that those of us who aren't from the finance world, it's a new topic. Do you have any other suggestions? You had given, I think, a pretty good overview of a number of different funding sources. Any other tips for how do we pick where to go? How do we just learn more in general if we're not quite ready to pull the trigger or approach financing?
Yeah, I think that's a great question, Andrew. I think it's hard. My answer to that would be talk to a CDFI. And CDFIs most CDFIs belong to an organization called Opportunity Finance Network, or OFN. And you can go to ofn.org for a listing of all the CDFIs. You can find CDFIs in your state. Again, you can always talk to PCDC. And the reason I say that, without a project, you may not have a project. But what we always encourage folks to do is, it's our perspective that if you're operating in a community and your services are needed and the community, and it's working well with the community, eventually you're going to have a project because your demand will grow, and that's a good thing. whether you use PCDC or somebody else, approach a CDFI just to ask questions about, for example, new markets tax credits. It's a very complicated program. I often kind of lightheartedly say the average new markets conference lasts 3 days. In fact, there's one starting tomorrow that I and some of my colleagues will attend. It's a 3-day conference. My average discussion will be, my average comments on new markets last about 5 minutes. So obviously you can't get into that program very deeply, but it's worth having just conversations with an individual whose background is finance, who works with a mission-oriented organization, who's not going to hound you about making a loan, etc. Most of we talk to dozens of organizations all year. A fraction of them actually have a financing need, but we're happy to do it because that's part of our mission. Somebody just asked if PCDC has any more new markets allocation. No, unfortunately we do not, and we're in most of the institutions like PCDC do not have allocation, but the worst time to ask institutions if they've got allocation is when they just get allocation. It's because the allocation's already been spoken for. When we and all of our peers apply to the US Treasury, we have to demonstrate very active pipelines. And we usually show pipelines that are, twice the level of what we're actually asking for. Now, not all those projects come to pass, but the time to have those conversations is frankly now. It's not when the awards are announced. It's whenever you are ready to begin inquiring about a project. But certainly the average, what we call gestation period for a project for us, without exaggeration, is about 18 months. And while the underwriting and the lending only takes about 3 to 6 months, it's the 12 months ahead of time of conversations that lead up to that. To answer your question, what should they do? Feel free to reach out to, I would reach out to your associations. They may have, a finance desk and somebody who can offer some advice. But certainly, your CDFIs are really a unique animal in that they are financial institutions. They've tapped into the capital markets, but they are very mission-oriented, and so they're very much on your side. That's why 30 years of finance, I have to say, CDFIs are a lot of fun, and it's they're really a godsend to the mission-driven world. They're great.
And this is Andrew. I just want to, in our last second here, I just want to make one last plug. Another comment we got in the chat was about just the receptivity of behavioral health in general to the integration of primary care and behavioral health. And this is a topic that's high on our minds here. I just posted a link to the chat, but you can also check out our behavioral health integration report at pcdc.org/resources. And in that report, not only do we talk about some pressing needs around and the kind of current state of behavioral health integration, but we highlight a great and very successful story of an integrated care, primary care behavioral health organization that we actually arranged capital financing for that very purpose. So I think great question, very topical. So, and we're officially at our time here. So again, thank you everyone. We will be sending out the recordings and the links. Thank you to the National Council for Behavioral Health, and of course to the members and all of you who have joined and lent your time to us today. And I think that's us signing off from PCDC here.